Welcome, dear viewers, to our natural medicine format. I would like to talk about gold implants again today because it is so important and simply because far too few people are aware that this possibility and these options even exist. Dr. Harald Burgard, the doctor who always brings this to us on television, is also here today, but he has brought another patient with him, a veteran of a man who has also experienced his own problems and at some point dared to get help with gold implants. The aim of the show is to give you a really credible, totally authentic account of what he has to say. But first I'll start with Dr. Harald Burgard. Welcome.
Hello Alexander, good morning.
Good morning. And this gentleman, you've already performed several operations on him. So not just on his ailing shoulder, but several sites have already been repaired, right?
Exactly. We did the shoulder, we did the thoracic spine, we did a knee.
And? Feedback from you briefly?
Let's listen to that in a minute.
All right.
Obviously good, otherwise he probably wouldn't have had the other operations done.
Yes, of course. So, let's welcome Mr. Mohr here in the studio, connected via Zoom. Welcome to the studio.
Yes, hello.
So, how does a man like you come to be involved with gold implants?
Yes, I would say it's pure desperation. I've had 18 operations in my life, on joints and so on. And things didn't work out the way they were supposed to. And then we came across this gold implantation, or rather I came across it, through a well-known vet, who also does gold implants in animals. And he then put me in touch with Dr. Burgard. And that's how I came across the gold.
So, you've already had other operations before?
Quite a few.
Quite a few. Where, on shoulders or knees or where?
Yes, it started with the cervical vertebrae. I have artificial discs in the cervical vertebrae, between C5, C6 and C7. That never really worked. The only thing that has helped is that the numbness in my hands has returned. But I didn't feel really well with all that stuff. That's how it actually started. Then several shoulder operations on the right, shoulder operations on the left. The clinic where I had the last operation on my left shoulder then told me that it was out of therapy. That if it didn't get better, only a new joint would help. And that's when I said to myself, I don't necessarily need a new joint because I'm not the oldest yet. And that's why we opted for the gold. And that was great. I had it on my left shoulder. I had dropouts. In the end, it was so painful that I fell to my knees in pain. I didn't know what to do with my arm. It was small movements where it suddenly shot out. There was this pain where I was just spinning in circles or lay on my knees in pain. And after this gold implantation, on the day of the implantation, I have never experienced that again since.
So it worked, immediately?
Excuse me?
Did it work immediately after you had the operation? On the shoulder with gold implants?
The dropout I had in my shoulder, the pain, where I no longer knew how to help myself, that hasn't happened since. The pain was still there until the gold worked and so on. But I'm really happy with it. It's just that you always have to be aware of it. There is something wrong with the shoulder. You still have a defective shoulder joint. Of course, if you overdo it now and think you can chop 3 meters of wood and so on, then you'll notice it again. Then of course you'll have pain in your shoulder again, with the difference that the pain will be gone after 2 or 3 days at the latest, which wasn't the case before. I was just walking around with shoulder pain. It then went into depression and so on.
So you got your total quality of life back, right?
Definitely. I'm also very grateful to Dr. Burgard for that.
Now that was the shoulder on the one hand, I've heard, but I've also heard that you've had other issues addressed after this satisfaction was achieved.
Yes, as I said, that was also the cervical vertebrae. Dr. Burgard also put gold in my thoracic and cervical vertebrae. Of course, this is also a great relief for me because it was always a drama for me after all these disc operations. And it never really worked somehow. I always had pain in my knee. I had constant headaches and so on. And then of course we said that after the shoulder operation, because it worked so well, we do the cervical vertebrae and the thoracic vertebrae too. And the thoracic vertebrae, they also hurt all the time and so on. I just did a lot of physical work, heavy work and so on, and of course everything is ailing then and I feel good about it now.
Wow.
It's wonderful.
Now my question, you started out with other operations at first, conventional medical operations, because you were not yet familiar with the gold implant. Would you have done it the other way around now with today's knowledge? First try the gold implant and then surgery if you had to?
Definitely. By all means. I would have saved myself a lot, I have to tell you honestly. If you then have a knee operation, the third one, and you go back to the doctor who operated on you, and you say it's not right, there's still pain in your knee, and you're then told to get over it, you have knee damage, of course that's a statement where I say, I don't know, I could have saved me that.
Yes, it's quite frustrating when you think how many people are walking around out there with exactly this statement. You now have to live with this pain. So you did the knee and the knee no longer hurts.
No, not to this extent. It always depends. I can't really rest, I have to say, of course. I'm still very active. So one still notices it, but it's nowhere near what it used to be. So I would do it again anytime. Anytime. And the next construction site is my left foot. Yes, once we've done that, then the wrists will come, because my wrists aren't as good as they used to be from working and so on. So surgery is no longer an option for me.
How did you feel about the operation with Mr. Burgard? It's only a short operation. 2-3 hours in and then you go out again afterwards and you're done, right?
Well, it was very relaxed, I have to tell you honestly. The local anesthetic alone was quite an experience for me. Now, for example, with my left shoulder, where I actually only had pain and the local anesthetic, Dr. Burgard palpated all the points, palpated the pain points, examined them and anesthetized them locally. That was an experience. I had no pain in my shoulder. That was another thing where I said now things are getting better again, so that was a very simple thing. No general anesthesia, just local anesthesia. Perfect.
When the local anesthetic stopped working and the gold was already in, how was the pain level? Already less, or the same again and only went away after a few days, or what was it like?
It takes time, but for me it started like this after 4 weeks when I realized that something was happening. I couldn't tell exactly, but I noticed that something was happening. But let me put it this way, the shoulder took about 8 weeks, 10 weeks, then it was perfect. It was worth the wait.
I have another important question. We have a lot of viewers, and there are certainly many of them who now have foot problems, foot pain, knee pain, hip pain, back pain, shoulder pain, maybe finger pain, and so on. Osteoarthritis, nasty stories. What would you say to these people now, just from person to person, if you could speak to them directly right now?
Was würden Sie diesen Menschen jetzt einfach so von Mensch zu Mensch sagen, wenn Sie die jetzt gerade direkt ansprechen könnten?
Yes, I can tell you that too. As I said, I've had about 18 operations and every operation has its risks. That's always the case. And my experience is also that operations are always performed very quickly. And once you've had the operation, you're dropped and sent home. And then nobody cares anymore. You just have to see how you get on. So I wouldn't do it again. I can only recommend gold implants to anyone. A little patience until the gold takes effect. There's nothing better, in my opinion.
Wow. Yes, I can't say anything else. We'll take a look at a few pictures later to see what it looked like on him. But Mr. Mohr, thank you very much, because what you've just said here gives an incredible number of people great hope and a great chance of a life worth living without pain.
It definitely helps. So I can only pass that on. I've experienced it myself. And as I said, the next story is coming up is my left foot. Then I still have the wrists. So, Mr. Burgard still has some work to do.
Yes, you're a big construction site.
Yes, it's like Berlin Airport, isn't it?
Yes, great. Thank you, Mr. Mohr, it really was great having you. Very important statement from you. I'll send you the video later so that you can see what you did here on television today. But thank you again, and we'll see you again. All the best for your health and stay pain-free now.
Yes, it'll be fine. Thanks to Dr. Burgard, everything will be fine. I'm quite confident about that. Thank you very much.
Thank you.
All the best, Mr. Mohr. Bye. Yes, dear Harald, that was incredibly nice. And I've really announced a true original. That really is an original of a person, a man. And for someone to have to go through so much suffering, that's sad.
Yes, this is, let's say, a person who is in life, who is physically very active, who has to work a lot, who, as we know, is generally insensitive to pain, especially when it comes to tall people, and yet he really had this severe pain for years, many years. Operations. And I'm always impressed myself when I see that gold actually helps these people. And we've heard of many cases now, and we've known for decades that it actually helps permanently with treatment. And I think that's just cool, because you keep your own joint. Yes, it's not as good in the body as your own organs created by nature. Yes, and as long as you can keep them, that's a blessing. And if they are still pain-free, cool.
Yeah, I mean, when you think that he says he was in so much pain that he was put to the ground. I mean, I don't want to know how he sleeps. Back then.
Yes, he couldn't even lie on his side anymore. So if you ever had shoulder pain, I once got tendinitis doing sports. You don't know how to lie down anymore, you can't hold your arm, and then when you're having that for such a long time and operations, that's almost torture.
You've brought a few more pictures that we would like to see what an operation looks like and also a few statistics.
So we have over 280,000 in Germany, over 230,000 implantations of new hip joints, over 168,000 knee joint and shoulder implants every year in Germany. Around 25,000 artificial shoulder joints are fitted and almost 26,500 operations are performed on feet. That's a huge number. That means that there are an incredible number of people who suffer from these complaints, and these are numbers per year. And here you can with gold implants, with small pieces of fine gold, relatively long-lasting effects can be achieved. And with him we have a few points marked here. This is Mr. Mohr's shoulder before the gold implantation. This is what it looks like when the gold is in, so you can just see a few small punctures. And afterwards it looked like this. Various points are treated. In this case, there were over 30 little gold pieces in there.
Did you have an X-ray to know exactly where you were?
Yes, that was the one I had just clicked away. I always look at an X-ray, but the X-ray helps me to see what the joint looks like. If there is no destruction due to a tumor or something that you can see which would have to be operated or treated in some other way. You look at the joint, but where I put the gold always depends on the joint, and I just have to feel it. I can decide on the basis of a picture, but I really have to feel it. Just like you do with other therapies. When I do a therapy, I also have to feel where I go in, where is the joint, and how do I hit the point with the needle. It's similar here, and then you place this gold on the relevant areas. Yes, and this is what it looked like afterwards. As you can see, we stuck the plaster on there. And then the gold starts to take effect and, as he said, after a few weeks it slowly becomes less and less, and at some point the patient is free of pain. Yes, that's gold. Yes. And as I said, the effect is caused by the gold getting into the tissue, attacking the cells in the tissue, releasing gold ions that cause the inflammation and swelling to subside, and that permanently. And so that the pain also disappears. And we've just heard him say that if I chop wood or exert myself in some way, it hurts again. And we have seen in science that the body then releases a little more ions from the gold for a day or two, and then the pain stops again, and then it goes away. This is in line with the scientific findings and what the patients say. Dr. Intrizzi, who we've heard of before and who also does gold implants, for example, damaged her knee and was pain-free after the gold implantation. If she overdoes it, walks too much, dances too much, she'll have more pain for a day or two. But then the patients know, okay, it's only for a day or two, because the gold release is increased again, and then they are pain-free again afterwards. And that works very reliably. For a lifetime. Have you done anything else on him, nutritional circumstances, or anything, or did you just put gold in and bang, he can carry on with his life as before? Yes, well, he really was a patient who only came for gold implantation, which is usually the case. I have patients who come for detoxification and so on, but most gold implantation patients really only come for that. And we didn't do anything else. We just put gold in and let it work. And then we heard that the shoulder was fine at some point. Then he just had severe pain, including burning, pulling pain in the thoracic spine. He'd already had operations on his cervical spine, so I treated that too. That was also good at some point. Then he said the knee had to be done. Then we did the knee too.
Yes, he had to build up confidence.
Exactly. That would a patient probably not do if it didn't help him.
My other question is, if something is broken, it can't be restored even with gold implants. But in this case, something was broken. That means it wasn't just purely inflammatory, but something really was broken, wasn't it? Because of his overexertion.
Yes, you always think that if a joint has osteoarthritis, then I can't do anything with it, but the cartilage itself and the underlying bone don't have any nerve fibers. This means that the pain doesn't come from there, but from the joint capsule that surrounds the joint. And that's where we put the gold, so that the inflammatory pain and persistent pain disappear. And then you can walk on these joints without any problems. There are limits, so if someone has a knee joint where the bone is destroyed, then it's no longer possible. But that's very few people. Most people actually have cartilage that has worn away, or, in the case of the spine, the facet joints or whatever. And this inflammatory stimulus that comes from it is stopped, and then people are pain-free.
That was really exciting, because most people or experts I talk to don't even know that when a plate is on a plate, it's not the plate that hurts. Instead, the pain is actually on the outside of this tissue, and this is exactly where it starts. The plate stays on the plate, doesn't it? But that doesn't cause any pain.
That's actually the case. I also thought at the beginning that it couldn't work, because if the joint cartilage is gone, then it hurts, then it rubs and hurts and hurts. But it doesn't.
That's logical if there are no nerves.
Yes, and you always have to say that if I have an inflamed joint capsule, then of course it no longer forms this synovia, i.e. the lubricant that is necessary in the joint so that the whole thing glides to some extent. But when the inflammation subsides, the formation of synovial fluid is restored. Better. Not optimal, but better. There also seems to be an effect that means people can walk on it without discomfort. And we hear that it works. Just as the bumblebee was not allowed to fly according to the laws of physics, and still flies, yes. That's how runners and animals have been walking around on joints for decades, even though it's not actually possible. Yes, and veterinarians have been doing it since 1975, and our colleague Kierkegaard has been doing it on humans since 1983 and has seen that it works, and we have been seeing it for decades, and we see it through my patients, we see it through other patients, that it works, even though we in conventional medicine believe that it can't work. And yet it works, and people tell us so.
So every osteoarthritis patient, now that I'm talking specifically about osteoarthritis, would also have an option here, wouldn't they?
Well, osteoarthritis is the option per se. Osteoarthritis simply means that the joint cartilage is damaged, which causes pain. By putting gold there. Not the arthrosis. But it doesn't necessarily go any further. That also has seen that there is then no destruction that continue. That's also exciting. That's probably also due to the fact that the synovia is better again. Is formed again. But the fact is, I can live on an osteoarthritis joint, whether knee, hip, foot, neck or spine. I can achieve improvements or complete freedom from pain simply by putting gold in it. And gold is the strongest anti-inflammatory substance of all metals in the world. And fine gold is pure gold. We don't use an alloy, we put pure gold in there.
And everything is done on an outpatient basis. And you go home the same day, and now you give it a chance and wait for a day or a month or 3 months. We have also tested this, dear viewers, even if we did see such authentic guests like the one we've just seen with Mr. Mohr. We have also engaged someone else to test this, namely my mother herself, who will also come to the studio today, make a program and report on how it was for her, because she could hardly walk anymore. She had severe osteoarthritis in her knees and can only say in advance that she is pain-free. She walks around without any problems, and I personally see that as a small miracle. Yes, dear Harald. Now of course we both have to make sure that as many people as possible know that this exists. And B, you don't have the chance to do it alone. Doctors and therapists have to contact you for the training, don't they?
Yes.
It has to spread.
The number of people, I mean, we're not just talking about Germany, we're basically talking about a worldwide problem. Of course they have the opportunity to benefit from it. And at the moment there are hardly any colleagues who are doing that.
So the start has really been made, the starting signal has been given. When the therapists say to themselves, that's totally convincing, I want to learn to offer it too. So in Switzerland it has to be doctors, because alternative practitioners are not allowed to prick.
Absolutely. And you have to train your colleagues properly so that you simply do the right thing. Even if it looks simple, there are a few things you really have to pay attention to. And you have to know exactly what to put where, when, how, and in what quantity, and in what size, and so on at each joint so that it really works.
How long does the training last? Do we perhaps want to mention that briefly?
Well, the colleagues have to look at quite a few operations. They have to have operated on every joint themselves several times so that they can do it themselves.
And under supervision.
And under supervision, yes.
So there aren't 50 doctors there at the same time, there are always small groups.
So when we train, we do it one-to-one. It's not training that you can do in theory, where you say we're going to make an online store and tell you how to do it. You have to learn it, just like any other operating technique. And you can only do it properly if you've done it many times.
Right, now we've spoken about the doctors and therapists. Now, of course, we also have to offer the many people affected an option. What should they do if they really want to use this plan B, or actually plan A, before any operations, if they want to be pain-free?
Yes, what can they do? Well, if the conservative options have been exhausted, this is an alternative to surgery. I personally believe that the sooner you do something, the better. Yes, so don't wait until the joint is really completely destroyed, but get informed, get in touch, and then you can have a personal discussion to see if it's suitable. In the vast majority of cases, gold surgery or gold implantation is not a problem.
Is there a waiting period if someone comes and says urgent?
Yes, of course, as with all colleagues. You can't call and get an appointment tomorrow. We already have a certain waiting list. But it's also the case that if I notice that the patient is coming from somewhere where a colleague is nearby, then I recommend them to them if it's taking too long with us or to Ms. Intrizzi or wherever.
Oh great, so you have a network and can help, even geographically, so that people always have very short distances and can find a solution.
Relatively.
Yes, there are now, 100 million people in German-speaking countries already, and many of them have osteoarthritis problems. Yes, well, thank you very much.
Thank you.
Very valuable program, and I would simply like to ask you, dear viewers, to pass on this program and the people who really have a health problem with their joints and are in pain and have to live constantly with painkillers in high doses, and perhaps the next operation is just around the corner, that at least this program is shown to these people and that they are shown an extended option, a possibility that can perhaps also relieve their pain much more gently.
Eine erweiterte Option zeigt, eine Möglichkeit zeigt, die vielleicht auch viel schonender Ihnen den Schmerz nehmen kann.
And I would sincerely hope that we could work together, rather than alone, to bring this program to these people who really need it and of course deserve hope. With this in mind, all the best. Thank you for watching. See you another time and goodbye.